Assalamu alaikum. Today we are recording an important lecture which is focused on the prevention is better than care or cure. So I think this will a holistic approach to health, exploring the importance of preventive health through historical, educational, and technological. And from this, you can understand that how prevention is better than cure. So something important you can see from the picture that how healthy, beautiful with a bird and looking uh, energetic or enthusiastic. So this kind of health is required. Let us move further. Yes. You can see that the prevention touches or focuses on reducing the incidence of diseases through proactive measures rather than reactive care. The cure is basically a reactive kind of approach, but the proactive means earlier and a preemptive, or you understand that this is needed. Emphasizing health promotion and disease prevention can lead to improved quality of life and decreased healthcare cost. Decreased healthcare cost is important. Uh, then uh, that I should Hygia, you can see the goddess of prevention in Greek mythology. You can see the Hygia, the daughter of Asclepius, the father of the medicine, presents the importance of health and hygiene in disease prevention. Her image serves as a powerful symbol of our commitment to promoting health and preventing illness through proactive measures. And you can see these images from the artificial intelligence. She is giving milk to the snake in the bowl, and so snake is the symbol of health and medical profession. And the Hygia was one of the daughter of Asclepius. He had many other daughters was Panacea, which stand for the cure or elixir of life. That a medicine, a single medicine can cure all the diseases was the concept of Panacea, our sister, but her concept was prevention is better than cure or care. And ultimately, these two branches developed into preventive care and curative care or prevention and cure. So it is said that the drop of prevention is better than the ocean of. So after this, let us move further. Evolution of the disease. This is a new concept which I read in one of the book, a historical perspective. Understanding the milestone in disease evolution help shape modern prevention strategy. Ancient time, then Middle Ages, then 19th century, then 20th century, and 21st century. So you can see that uh, if I can zoom it, yes. So let us move further. Ancient time. Ancient society disease were often attributed to supernatural forces with prevention focused on rituals and hygiene practices. Then the second point is uh, Middle Ages. In the Middle Ages, saw the emergence of quarantine practices during epidemic like the Black Death, making a shift towards systematic public health strategies. And then in the 19th century, The germ theory of the disease was established, leading to improved sanitation, hygiene, and became essential importance of disease prevention. But as I am from the Indus Valley civilization, sitting from Hyderabad, the Mohenjo-daro, the Harappa, and the Indus civilization has a planned cities, planned sanitation programs, and a hygienic program. So we are, I think, ancient than the Hygeia, which was 400 BC, but the Mohenjo-daro and these uh, archaeological evidence shows that the 5,000 years BC, at least this was the situation, great baths, hygienic, covered drainages, planned houses, as well as there was a community bath, or we call it great bath. Then coming to the 20th century, vaccination program and antibiotic revolutionized prevention and treatment of disease, significantly reducing mortality rate. So basically, vaccine actually became the counterpart of the medicine, because before that sanitation and these things were available, but nothing was to inject or to give to the patient with the prevention. It was just advice, awareness, and certain rituals. But vaccination, so the preventive medicine replaced the hygiene, and ultimately it was converted into a public health and then community medicine. Then 21st century, the rise of technology and AI in healthcare is shaping new prevention strategies, enabling predictive modeling and personalized medicine. Personalized medicine. Now, from community, you can give a personalized medicine with the help of. So after this, let us move to the next part of the presentation, natural history of the disease, understanding the disease progression. So here you can see that the natural history basically starts from the simple disease, which is, we call it preclinical, then clinical, and ultimately with the complication. And then ultimately, the natural history of disease encompasses sequence of events that occur from the initial exposure to a causal agent to the eventual resolution of the disease. Understanding this progression is crucial for identifying key intervention points that can enhance prevention efforts. And so you can see that the disease progression starts with some kind of inflammation before it is normal, and then ultimately it goes to the full disease. Then a spectrum of the health from wellness to illness, understanding the continuum. You can see that the at risk, then disease onset, then chronic illnesses, then complication. Understanding the continuum of health helps in identifying critical stages for prevention, fostering a productive approach to well-being. So wellness characterized by physical, mental, and social well-being, where individual experience optimal health and vitality. Vitality is full of energy. At-risk individuals showing early signs of health issues, requiring awareness and preventive measures to maintain well-being. Disease onset, the initial stage of disease where symptoms may begin to appear, emphasizing the need for early intervention and education. Chronic illnesses, ongoing health condition requiring management, prevention strategies focus on lifestyle changing and ongoing care. Complications, severe health issues that arise from unmanaged condition. Prevention efforts aim to reduce risk factors and improve health outcome. This is the area where most of the uh, complications and hospitalization, ultimately either recovery or death situation occurs. Modes of intervention are levels of prevention: primary, secondary, tertiary, and even mode of intervention are health promotion, early diagnosis, prompt treatment, and rehabilitation. So the primary prevention focuses on preventing disease before it occurs through health promotion, education, vaccination, and lifestyle modification. So these are the three, four. In secondary prevention involves early detection and intervention to control disease progression, including regular screening and health assessment. So screening and health assessment. Tertiary prevention aims to reduce the impact of an ongoing illness or injury through rehabilitation, support group, and management of chronic. Primary prevention focuses on preventing disease if it occurs through health promotion, education, vaccination, and lifestyle management. Secondary prevention, already told, including regular screening and health assessment. Then tertiary prevention aims to reduce the impact of an ongoing illness or injury through rehabilitation, support group, and management chronic condition. So role of medical profession in promoting prevention. So most of the doctors or students are the healthcare provider. They don't understand their role. You can see that from hand washing, educating patients on prevention, conducting regular health screening, advocating for preventive policies, and collaborating with the community organization. The importance of MBBS and MCPS or FCPS student: comprehensive medical training. MBBS program focuses on broad medical education, providing comprehensive training, uh, including disease prevention and health promoting strategy. A specialized focus on prevention. MCPS program offers a specialized training that emphasizes preventing health, focusing on community health, public health policies. MCPS graduates are specifically trained to engage in preventive measures and health promotion initiatives within communities, often working close by public health settings. The role of nursing students in health promotion. Engaging in community outreach program. In Isra University, we have outreach program, medical camps and other things. Conducting health workshops, implementing preventive screening, advocating for health policies, participating in research projects. Health promotion strategies in Pakistan. In Pakistan, effective health promotion strategies are crucial to enhance community health and prevention of the disease. Initiatives include awareness campaigns, community health programs, and integration of AI technology for data analysis and disease prevention. Particularly, we have hypertension, we have epilepsy, mental health, diabetes, chronic kidney diseases, and even acute surgical intervention, and the communicable and infectious disease prevention, even vaccination awareness. You can see that the Pakistan is the fifth or sixth largest country, and we have high birth rate in South Asia. So we require a lot of vaccination, lot of adult health care, including reproductive and sexual health or STDs prevention. And you can see that how the people on the one side will require health, and another side research and training is there. So ultimately, the prevention is better than care or cure, a holistic approach. I think we have covered most of the aspect, and this was a trial from my side because I found one of the AI, they can make the presentation. So when I gave them prompt of prevention is better than care or cure, so I think this presentation was ready, and I thought I must make the video on it. So with this, I think we are ending. And if we can save it as a present PPT, then that will be a good thing for us. So coming to back to my presentation, I think I have covered most of the points. Thank you very much. Like Dr. Hussain Baksh Kolachi YouTube channel. And if you have understood something better about the prevention, evolution of disease, and the evolution of prevention strategies as well as mode of intervention, levels of prevention is commonly asked, and how the Hygeia and the old ages, middle ages, and 21st century, and from Mohenjo-daro or Indus Valley to uh, Egypt as well as to the China, how the health is a common ground for us. Thank you very much.